What questions or problems are you working to solve?
Questions and problems we're working to solve at FIP really fall under three big areas of work. I mean, there's much that we do to advance the profession worldwide. That's our kind of mission statement. But if you think about the issues that COVID has highlighted, they were there already. One such issue is around access to medicines, access to healthcare, access to professional services, access to prevention agenda and how we can support people to enable that. Access, let's think about issues that stop people from accessing the best available advice or services might include health literacy. And we know that age or social determinants may have an impact, but also as we move through our life and we encounter different conditions and different diseases, we know that might impact our health literacy. And then there's the whole issue about mobility and accessing services through technology, which is an enabler, but also a disabler. That brings me to the second point, which is the issue of equity. Now, we know that equity has been really highlighted, or should I say inequity, during COVID, where we knew that parts of our communities, our societies, our countries were more inequitable than others in terms of the ability to access healthcare or services or indeed medicines. Actually, if you think about that, then that's just been heightened. So impacting equity includes socioeconomic status, ethnicity, age, both very young, very old. What about comorbidities? What about the ability to pay for services or having insurances where that's appropriate? And then the last piece around all of this that just seems to override everything that we do is around sustainability. And I think it's really important for us to remember that sustainability is such a catch-all word. We can use it willy-nilly that we don't think about that meaning. But in FIP, we've got to think about sustainability in terms of how we manage every step of medicine's use process, from the development to the, I suppose, the discovery, the repurposing of medicines, how they are, and I'm using the access word again because these are all interrelated, how these can be accessed for clinical use, how we monitor them, and then even the impact of their disposal. And we know this is a massive issue now. We know that we're seeing the impact of, let's say, oral contraceptives in fish. We're seeing how the disposal of medicines can impact the water that we drink. And then, of course, there's the impact of air pollution on people who have existing respiratory diseases, but also on people who never had a respiratory disease at all. And we're noticing now that WHO recognizes the impact of air pollution on all our health, and indeed in countries now we're seeing criminal cases about air pollution being above a certain level. And the final piece in the sustainability area would be the fact that it's truly unethical. If you've got a fantastic service that has been developed and implemented in a community, in a hospital, anywhere where pharmacists are delivering that, and you're not able to afford to sustain that, that's unethical to remove it. It's much worse in our view that you would remove it rather than ever implement it in the first place. So sustainability of services, particularly post-COVID, when we know that the iceberg of unmet need is just bigger than ever, this is a really, really important area for us. So we've got loads of work streams that fit under this that deliver our goals, but those I think would be the three main big tickets for the until 2030 at least.
Why have you chosen to pursue this question or problem?
The issue that we found was that pharmacy and pharmacists stepped up at every single point in the pandemic. That was a stretched workforce already. We know that in 2018, WHO had made estimates that the entire health workforce would be some 18 million short by 2030. Now we know that actually the health workforce in all our countries is diminishing, with people being exhausted, themselves having long COVID, or indeed just feeling not valued or valuable in terms of health contribution. And we know that when everything else closed down, pharmacy was the profession that remained open and accessible everywhere in all our communities. Unless we have the appropriate investment and the appropriate recognition of pharmacy as a vital healthcare profession, as a vital part of the health workforce, we don't believe that's sustainable. And as other professions step aside or become diminished in their numbers and their impact, pharmacy can't just automatically step in and take up the mantle. We have a unique contribution to make, and we've demonstrated that we can step into many, many healthcare challenges and opportunities but we do need to be recognised as part of the healthcare team. And by doing so, by ensuring we have a sustainable pharmacy workforce offering sustainable pharmacy services that meet the needs of that community and those societies, we're certain that we can provide equity and access to medicines wherever patients are. We've seen that. We've seen pharmacy stepping up and devoting themselves to problem solving over the past 31 months. And I think this is a really important point. For sustainability of the health workforce, we need pharmacy everywhere where a medicine is being used, and then we can ensure access and equitable access at that.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
This is a really great question about how can we individually or as a society step in and solve these problems. So imagine if we all understood the impact of the medicines that we're using and the impact of the waste on the environment that we live in. Imagine if we all understood that if we dispose of our medicines wrongly, or indeed even by taking medicines, that we're impacting the water that we're drinking. We should become a little bit more advocate of safe water. And within that as well, how are we getting rid of these medicines? If they have to be incinerated, are they being incinerated in the best way possible so as not to impact the climate? I think all of us have our consciences are being pricked more and more in terms of climate change now as we see these big impacts on our own environments. So I think if we can recruit patients and the public to be advocates and ambassadors for sustainability in medicines, I think that will be really important. Of course, there's a wider piece around air pollution. If we can all play our part in, perhaps not driving as much and using alternative forms of transport, that makes us good citizens. But I think it would also help if pharmacists spoke very clearly that this would have an impact on all of our lives, not only ours, but our children's, our elder parents, our grandparents, elder people in our communities. It impacts all of us. So I think this community that we embraced during the pandemic, if we can ensure they feel part of the solution, I think that's a real benefit to us all. I think there's also a final piece here that we should think about others a little bit more. We know that in many communities, the community pharmacist and their team would do deliveries during the pandemic, even if they'd never done that before. This is an unrecognised service. So imagine if when we were giving medicines to somebody who was collecting them for their mum or even themselves, said, would you be able to pop these medicines into your neighbour and just check that they're okay, and then come back and tell us anything? If we could empower people to do that a little bit more, I think there's something there that could be explored. We know that some of these practices exist in other countries, and by sharing that being part of the community practice, I think really helps us understand that community pharmacists can trust their community, they recruit from them after all, and then they can be part of their community and get the community to be part for them. We've noticed that community pharmacy is a real hub for networking and for understanding the community that they serve by keeping an eye out for elderly patients. Perhaps they haven't seen them for a while and they might drop in on them, or they might see that there's an elderly patient who isn't communicating as well as they used to and then alert people to that. Or they might be able to work with somebody who's acting as an advocate, let's say a grandkid of somebody who can't speak the language. It's really, really important that we understand how we can all step into this access, equity and sustainability agenda. And we can't do it on our own at FIP. We're totally dependent on the profession that we serve. So I think the profession has the ideas up its sleeve and they will definitely be part of the solution.